Welcome to the Wise Divine Woman podcast and the Facebook Wise Divine Woman pages, all things glorious and wonderful. Today we're just relaxing and enjoying all that we can do in our Ontario restrictions and all the loveliness that this spring weather is bringing us. And I hope you're enjoying your beautiful day today. So today I wanted to talk a little bit about the first part of vaginal health and how this actually plays a role in perimenopause and menopause. So there's a few different issues that we kind of run into with the vagina. So there's 5 changes. So I'm just sort of Cole's notes. If you want to dig deeper, please seek a professional, a naturopathic, myself, for one-on-one to actually go for the different needs because vaginal health is so unique to so many women. And then we have so much fun in life. And then all of a sudden, boom, we're blindsided by the changes that happen during menopause and perimenopause because we weren't paying attention to the inflammatory markers or the hormonal changes when we were younger. And I think this is something that we need to always stay focused on when you're younger, like in that 35 to 45 range. Pay attention to the symptoms, pay attention to balancing your hormones, and reducing inflammation of the body, removing the toxins out of the body so that this transition, and if your estrogens are out of balance, and the estrogens play a huge role, but if you're paying attention and staying abreast of these things, then you're not going to run into so many scary symptoms when you become older and you have no more kids in the house and you're retiring and you're looking to live life to the fullest. Things happen, girls. Pay attention, reduce it, be aware, and do everything you can when you're 35 to 45 to balance out the estrogens, revitalize the body, restore balance so that you don't have these uncomfortable symptoms. So we know that during menopause, and we talk about this all the time, our estrogens, of course, drop, and our physical changes to the vagina, the vulva, and the vaginal opening change. And if you're someone who has that sort of imbalances at a young age, it will only get worse. It will only get worse. So pay attention. If you're experiencing dryness and urinary tract infections, just know that as you're in menopause, most post-menopause, because your estrogens are low, sometimes estrogen suppositories will work. Working with products like Estromend, things like that can actually help. But when you're looking at these changes, it's called vaginal atrophy. And now it's sort of a syndrome. It's a genitourinary syndrome of menopause, which is called GSM now. And it affects actually half, if you can believe it, 50% of postmenopausal women, according to some new research out of the obstetrics and gynecology office. Anyways, that was out of 2016. So with the more stress and the more difficulties that we have balancing hormones, that this number is only going to go up. So top 5 changes that could happen to your vagina during menopause. Sex can be uncomfortable or even painful. So we know in normal life we have this beautiful thick wall in the vagina that's called rugal folds, and it allows for that expansion and or contraction either to accommodate a child, a baby, or a penis. So it's that sort of that aspect. These rigid rugal folds flatten, and so or that has all that. But as we age and our estrogens diminish, it flattens and it becomes thin. So it can become painful with penetration. You can, even with even on the outside of the vagina and the vulva, it also can become thin, inflamed. It can have red patches. Even if a doctor touches it with a swab when they're taking samples, just to ensure, even the opening of the vagina can be very painful as well. So this is a serious conversation that you have to have with your medical doctor, and then they can refer you to a gynecologist if that's the case. If not, seek a naturopath who can prescribe bioidenticals or compounded uh, hormones that you can do suppositories. Now, if this isn't a choice for you, there are some beautiful vaginal serums to help smooth and soothe the vulva um, when it does become irritated, and to maintain that pH balance. Again, you want to talk to your doctor and or seek a naturopath or someone who can prescribe. If not, there are nutritionists and other holistic practitioners that can help you. So please call me or seek someone who can help you. Number two, it can also burn when you pee. Feeling that burn, it can be that the lining of the vagina and the urethra, because they're very similar, and they are both affected by the estrogen receptors, when the estrogens drop, the tissues dry up. And that leaves a landscape or environment that gives bad bacteria, a chance to populate, right? It's usually acidic, and you know that the balance of that is very delicate. So if you have a perfect storm, if you have a bladder infection and in the urethra, and this also changes quite often when your estrogens drop. Cranberry juice, of course, D-mannose, and probiotics are all super good. And remember, a few weeks ago, we spoke about probiotics and the benefits of that for breast health, but there are also probiotics that are beneficial for vaginal health as well. You want to allow it for the proper bacterias, to take over the landscaping so that the bad bacteria can't stick to the walls and cause differences. So even your vulva may look different. So it's interesting. Has anyone ever taken a hand mirror and laid down comfortably, propped yourself up on pillows, take a hand mirror and look at your vagina? Of course, it's a beautiful, beautiful before children, a little distorted after children. Always good to note, even to look during pregnancy, that you don't have a varicose vein or anything bulging in that aspect, just to be sure, because you don't just want to, you want to keep an eye on this aspect, even using some really beautiful oils from, say, Godessa with Carly Samalt, or perhaps Living Libations, or make your own with coconut oil. Our essential oils can be very beneficial. Now, the Living Libations, they have a couple of different blends that can reduce inflammation, that can help with birth, and then they can help in the passion portion of things too. But you want to know that the labia, the vulva, all of that can also change as well. So watching, if you're doing your breast checks once a month, do your vaginal checks too. You do want to check for lumps and bumps on the outside of the vagina, even on the inside of the vagina. Look and feel that the texture is still the same, that there's nothing weird, and that it looks fine as well. There are many women that have vaginal cancers, and it's really something to sort of keep ahead of, right? We want to certainly be proactive about not just our breast health, our overall health, mental health, all this, gut health. Let's not forget our vagina. So we see the actual thinning and flattening of the labia, and this can, over time, some women may actually lose their labia minora. So you want to always keep an eye, and just, it's yours, understand and look at it, what it looks like, and so that you can respect your body better and love on your yoni much better as well. So yoni is more of that holistic word for the whole, the vaginal cavity, the vagina, the uterus, everything, so that yoni kind of idea. So what's important, it's not always to treat the inside of your vagina, but it's also about the outside. So if you want to evaluate both areas often, so that you can stay ahead of whether it's shrinking and or it's too sensitive, or that you want to ensure that even the vulva looks fine. and it will change. It may change with menopause and postmenopause. The vagina's microbiome may shift. I love that. I love the word microbiome. It makes me think of, that terrarium that you would grow. But it's not unusual for the vaginal pH to change. This is number 4. The vaginal microbiome pH will change with menopause. And normal, healthy vagina pH is low, right? But as a woman develops, that pH may increase. A rise in the pH alone won't cause symptoms, but it will cause the altering of the microbiome, right? This whole beautiful landscape of bacteria that's naturally in the vagina area. This also then leads to risk of increased vaginal infections, bladder infections, all sorts of different things in that way, increased inflammation, itchiness, soreness, tearing, things like that. To decrease your pH levels and improve good vaginal bacteria, you want to opt maybe for discussing vaginal estrogen suppositories. Talk to your doctor, talk to your nurse practitioner, talk to your naturopath, talk to your nutritionist to start the conversation so that you know the right way to ask, that you don't feel foolish about it. You can practice with a nutritionist or a holistic practitioner to make sure that you're eating the right food for hormone balancing and also what supplementations may help. But when it comes to the nitty gritty, like I've done with a few of my clients, we've gone through the questions to ask, we talk about what tests to do, and they were able to have a really good, confident discussion with their doctors and nurse practitioners. Now, it's also that you may leak a little when you cough. Now, I'll say sure, because it's all about the hormones that then make the muscles a little more weak. But it's not normal. I don't think incontinence is a normal portion or normal, like, oh, I'm just old, I laugh when I pee, I leak, right? Or when I laugh, I trinkle a little. I do not. I think this is a normal. I think there are many ways to look at it now. I think our sciences and our trainings and our philosophies have changed a little bit on this. So if you've got to go, you've got that feeling, make sure you get there. Don't struggle about it. Make sure that as soon as you do, but is this recognizes that you have your pelvic floor is weak. So there's a lot of urinary, symptoms that we sort of recognize when our hormones go out of balance, or when they our estrogens or testosterone or progesterones change with menopause. It becomes sort of this incontinence. Incontinence, I don't think, is a normal aspect. So you can see a pelvic floor physical therapist to ensure that you're doing the proper exercise. It's not just the Kegel, because the Kegel may not be the right exercise for you. You need to perhaps see a chiropractor or an osteopath or a massage therapist to make sure that that lower lumbar, from that L1 to L5, perhaps even the sacral area, the S1 to S5, I think, is also imbalanced, and there's no inflammation, no pinched nerve, no bulging disc to cause a muscle or a nerve deviation wrapping around the front through the dermatomes. That's what these people do. That's what they're specialized in. Yes, she may, because usually the physical therapist is a she, will have to go inside of the vaginal cavity and make an assessment with the muscles and the position of the bladder or the position of the uterus and the cervix to determine what's going to be best for you or what therapies are going to be best for you. Some women also use a pelvic floor activator. And I don't have mine here with me, sorry, but it's a device that you would use that you would be able to then squeeze and practice that also. And that was designed with a woman in Ottawa, and I do practice at her clinic as well. There are lots of great things you can do, but know that it's not a normal aspect. Reducing your inflammation, ensuring that your bacteria is in check, making sure that the muscles and the hips and the pelvic floor are also balanced and in check as well. It's, we can't help that, sex may throw our hips out, or we fall, we slip, we're dancing around the campfire, we fall. This may throw our hips out, and then you don't take care of it because you're not in pain now, but a misalignment will cause incontinence later. Even a gymnastics accident or riding a bicycle, and you fall off long time ago, will actually misalign the hips. We don't notice it now because we're always so active, but it's always to make sure that you're using that to ensure that. So that's sort of that prevention of incontinence, and practicing a sort of Kegel, which is important as well, and recognizing the foods and the herbs and the tinctures. Even we can go as far as even talking about yoni pots and yoni steaming, which I think is a fantastic concept. Not that I've done that yet, but it certainly is a delightful way to sort of think about things in a more holistic, traditional way to treat the yoni, and steam it with beautiful herbs to help like treat it in that aspect. So these are certain things to certainly wonderful to talk about. And even with when you're talking pelvic floor activators, you may also know that there are yoni eggs, which can also be inserted and held, and that way you can practice increasing that muscle strength there as well. Now, there are many other causes that you may have when you are talking about vaginal dryness as well. You do need to recognize that perhaps medications can cause dryness, just the same as medications can cause dryness to your mouth, or like the side effects of blood pressure medications, perhaps because they are diuretics as well, can cause eye dryness. They can cause mouth dryness. So you have to remember that they may cause dryness elsewhere in the body as well. So these are certain things to talk about, and your doctor may not know all the side effects to the medications that you're on. So ensure that you discuss this with your pharmacist as well, and say, okay, what are the side effects of the medications that I'm on, and how may it affect my genitalia, or how it may affect my vaginal health? And these are just, if we all just start talking about it, the world will be much better for it. We can't just go around thinking that, these problems, these sexual problems, or these things like that should just be swept under the rug. No, let's be proactive about it. Let's talk about these things like they're a normal conversation, so that our daughters and our granddaughters also recognize the importance of taking care of the body, not just the mind, not just the gut, not just the breast, but also the vagina as well. Know that when you are actually transitioning from perimenopause to menopause, our testosterone levels drop. And that's where we may lose a bit of that libido, and or this decreased desire and arousal. Now, in most good healthy relationships, you want to discuss this openly with your partner or husband, wife, so that you can be prepared if this does happen. Then what are the avenues that are going to be pursued to ensure that you're always making that beautiful, intimate connection, that both partners are aroused or satisfied or pleased, because it's part of our human nature to have this as well. And so it also depends on your culture, your background, and how you're going to talk about these things, your previous sexual experiences and things like that. But again, if we're going to start talking about it and making it part of a normal conversation, then I think we're going to overcome a lot of these sexual hurdles in time, because we want to, sex education just shouldn't be for the public schools to educate on, which is ridiculous. It should be part of a conversation you have with your children all the time, even into older years, which is funny because I'm sure it makes them feel very uncomfortable, but it shouldn't be. It should be part of that. So just as much as we have this issue as we transition with lower arousal, and there are different herbs that you can do, better eating, of course. There are lots of great sensual foods that you can utilize to bring out arousal or libido. A glass of wine might actually have one glass of wine, not the bottle, but the glass of wine to actually lower the nervousness, bring out inhibition, and just be able to enjoy each other's company in that. So it's always that open conversation to have these healthy sexual conversations with the with not your family, but your loved one. If it's just as important or just as good of an understanding to understand that vaginal dryness, of course, is part of a hormone relation. It also can be part of a deeper issue with the body, like inflammation or other chronic issues. And it can also change because of chemotherapy, radiations, illnesses, chronic illnesses. So keeping this always talking about the options, what's going to happen if, how can I support you, how can you support me? But men also have erectile dysfunction as much. Now with men, for instance, if you are seeing that your husband is having this difficulty, please be sure that he also seeks counsel nutritionally, but also with their doctor, because it may be a precursor to a heart condition, cardiovascular change as well, but it also can be part of a subluxation or a misaligned or herniated disc in the lower back as well. And please, it's so important to always maintain this health of the spine, since the nervous system is held there, that you're strengthening and stretching properly to maintain the core strength of things, and then also finding the ways that you can reduce the inflammation in those areas as well. It's not just for now, but it's actually for longevity as well. And I think that there are, it's interesting when you're researching and understanding. I think it honestly comes back down to, regardless if there's, if you have a libido, if you have an orgasm, if there's erectile dysfunctions, or, if you don't know how to, you've never had an orgasm, or you just don't ever touch yourself, or you don't ever do these things. It always comes back down to communication and knowledge. And when you're in a relationship, making sure that you're expressing your feelings, you're expressing and getting these things out of the way, so that you can then connect better with your partner, with your husband, with your wife, to overcome any challenges that may come. And don't just say, oh, I'm in menopause, oh, I have a headache. Or no, get down to the problems, understand, rebuild your comfort level about and your ability to communicate sexual desire, the response to one another, and the functionality of the body. So it's just about all the different things that you can do to allow this whole understanding as you age. Yes, of course, your vagina changes, the penis changes, your body changes, but in knowledge, acceptance, communication is actually where you're going to have the best conversations and the best relationships with the people you've chosen to spend time with. Um, yeah, so we're going to continue this talk later this week as well, talking about foods, talking about the different tools, and that's where I'll grab the other tools, and just continuing this great talk about vaginal health when it comes to your body and aging with menopause. Okay, I really hope that you've enjoyed that today. Thank you for joining me on the Wise Divine Women podcast and the Wise Divine Woman page. You guys have a great day today.